Hello, friends. Greetings to all of you all across the United States and Canada, and we also have a friend joining us from Puerto Rico. I am your host, Bernard Hernandez, and I am Chief Information Officer with DM&A. Thank you so very much for taking the time out of your day to join us. We have an exciting webinar in store for you, Benefits of a Menu Management System. We have a very special guest, Adam Johnson from Delegate Healthcare Solutions, and our very own Della Dunbar from DM&A. Before we begin, I have just a few housekeeping logistics. During the webinar, the phones will be on mute and you will be in listen-only mode. There will be a question and answer session at the end of the presentation. In order to ask a question, simply type it in using the questions box in your GoToWebinar control panel. Take a second to locate that. You can also type a question anytime during the webinar and we will answer as many as we can during the Q&A session. Those questions that we don't get to, we will reply via email after the webinar. I will also be sending out a post-webinar email, which will include your CEU certificate, a link to the recording to watch again or share with your colleagues, the handout, and other resources that we will be sharing today. You will receive the post-webinar email by tomorrow latest. In addition, you can also download the handout PDF from the handout section in your control panel. I am very excited to introduce our presenters today, beginning with Adam Johnson. Adam began his career in the hospitality industry, waiting tables at the age of 16. He then worked his way to a general manager and on to managing a 200-bed hotel and large conference facility. He then moved into the software industry, working as an installer and trainer for Micros Fidelio UK, the largest supplier of hospitality hardware and software in the world. Adam continued to find joy in serving the hospitality industry and found his home as the Director of Business Development of Delegate Healthcare Solutions for the past 10 years. Presenting with Adam is our very own Della Dunbar. Della wears many hats at DM&A. She is the Director of our Nutrition Informatics Division, a room service project manager, and a success coach. She has been part of the DM&A family for almost 10 years, and before that, she was a rock star client. Della serves on the Academy of Nutrition and Dietetics Interoperability and Standards Committee. She is the RDN with over 30 years of leadership experience, and she brings out the best in our clients that she works with each and every day. Ladies and gentlemen, please welcome Adam and Della. Take it away, Della.
So thank you all for joining us today. Before we begin, we have a poll we would like you to answer.
It's coming, Della.
Okay. So the question is, do you currently have a menu management system? So if you can take a second to respond to this poll, we would really appreciate that. While you're doing that, I'll begin talking about the goals of our webinar. So our goals today are to discuss the trends in healthcare IT. Adam and I were actually able to attend the HIMSS conference earlier this year, which is the largest health IT conference in the nation as well as the world. So we'll share a little bit of information from that. We're going to define nutrition informatics. We're going to identify how a menu management system can help reduce supply costs, how a menu management system can help you meet your regulatory requirements, how a menu management system can improve patient safety, and how it can also improve your patient experience and satisfaction. So our next slide, if you're ready, Bernard, we're going to keep the poll up a little bit. So one of the biggest trends that we heard at the HIMSS conference was about cloud technology. And Eric Schmidt said in his opening keynote to healthcare organizations, and this included CIOs from all over the world, get to the cloud quickly, the cloud is safer, more HIPAA compliant, and easier to use. Now, Eric Schmidt is the former chairman of Alphabet and currently a technical advisor to this Google parent company. And the reason he was promoting the cloud is that it requires less resources and experts to take care of security and the continual updating that needs to be done. So if you think about each individual healthcare system, hospitals, IT department, and their resources and how thinly they are stretched, there are things happening on a daily basis in the security side that somebody needs to look at. So if you have your data in the cloud, these cloud companies are responsible for that security, so then you can be working on what needs to happen within your structure. And because of that, the experts in security are maintaining your security, so that's why it is safer. And also in the cloud, there's large data repositories, which then can help with machine learning, and then data studies across demographics could much easier be done much easier. So the next trend that we had in mobile was the mobile technology. So I'd say the two hot topics were mobile technology and cloud at the conference. And in the slide, you can see how usage has gone up in wearable as well as mobile tablet app use over the last 4 years. Also, consumers, patients in the above 65 demographic, the use of data technology in that group is actually increasing at a much quicker rate. And they're finding that things like Alexa voice technology is really helping this group adapt technology, because due to arthritis and other things, it may be difficult to use a phone, but they can talk to an app. And healthcare systems are actually giving patients tablets to help with the monitoring of their blood pressure and other key indicators to help with their care. Adam's going to talk about a little bit more about mobile technology.
Hi, good afternoon, good morning, everyone. So currently, around 74% of healthcare are adopting the BYOD, so bring your own device, which is allowing the US workers to save an average of 81 minutes per week by using their own device instead of devices that are static within the organization. Mobile devices obviously assist with being able to move around and also do your work while you're on the floors, so that you don't have to keep moving back to the office to do your notes. Della, back to you.
So I want to talk about nutrition informatics. As Bernard mentioned, I do serve on one of the Academy committees related to nutrition informatics. And back in 2007, the Academy developed a definition of nutrition informatics: the effective retrieval, organization, storage, and optimum use of information, data, and knowledge for food nutrition related problem solving and decision-making. Informatics is supported by the use of information standards, information processes, and information technology. On the next slide, you will see the elevator version of this definition, and this is really what it boils down to. And nutrition informatics is the intersection of information, nutrition, and technology. And this icon shows how that all comes together. The goals of nutrition informatics are to optimize the use and application of nutrition in all areas of practice within the profession of nutrition dietetics, and to leverage nutrition informatics with external stakeholders to position the dietitian and the diet tech as key players to improve healthcare outcomes, improve operational efficiencies, and manage healthcare costs. On the next slide, we see the results of a study that was done by the Academy in conjunction with HIMSS. And this data is from 2011, so it's 7 years old. But in our work and being in numerous facilities, it might have changed some, but hasn't changed a lot. As you can see, in 2011, even though electronic health records had been adopted at 61%, the food service and diet office management was still at 30%. In a recent HIMSS survey, due to the push of interoperability and reimbursement being tied to having electronic health records, we're probably seeing electronic health record adaptation really up there closer to 90 to 100%. This study has been redone more recently, but the data was broken out differently, so we didn't get the data on the diet office and food service management. But in my experience in interfacing with various healthcare organizations, this number still is not above 50%. So we can see that we are, in our area, within healthcare, lagging behind the other parts. On the next slide, we see the food service cycle. And this is really what happens in our department. We plan our menu, we determine what we need for that menu, we purchase our supplies, we produce our menu, and then we serve our menu, and then we start all over. Adam's going to talk about how a menu management system can help us in all aspects of our food service cycle.
Thanks, Della. So the next few slides that we're going to look at all relate to how we can get costs and how we can save money by using a menu management software. As Bernard stated at the beginning of the presentation today, I came from a hospitality hotel background. And what amazed me moving into the healthcare industry was that there was very few facilities that could tell me at any given time what their cost of sale was, what their price per patient per day was, and also more importantly, what their stock on hand value was and how many stock on hand days they had left within their facility. This kind of shocked me in the hotel world. You're sort of tracked by this and ensured that everything comes back to the cost. So your pay rises are based on key performance indicators regarding how well you manage your stock. And in the hotel world and hospitality world, we try and ensure we run at a cost of sale of 25%, which means that we have a markup margin of 75% for the retail areas. When we're looking at the patient areas, we need to be as mindful as possible to try and save the money, knowing that we don't get an awful lot of money per day for that. If we can move to the next slide, within the menu management software, you will have your menu. And within the menu, you're able to forecast what your expected numbers to be, both in a retail area, in a events area, and also for your patient population. What this ensures is that once we plan our menu, we can then cost the menu and see if we're in line with what our cost should be. But it also allows us to create purchase orders based on this, so that we're taking the element of guesswork out of the process of purchase ordering. And on the next slide, the main key to doing a very good forecast and getting a very good purchase order is to make sure that we're doing inventories or stock takes. If you're on a manual system or you're on a electronic system, inventories can normally, or stock takes can normally take a few hours depending on the number of storage locations you have and areas that you need to count. However, within the Stellar application, what we have is the ability to do mobile inventory on an iPhone or an Android phone, so that what you can do is go into the locations, scan the barcode of the item, input how many you've got, and on the next screen you can see the screen entering for the Apple Red Delicious. We see there a potential quantity. The potential quantity is showing us what the system expects to have based on how much has been received into the facility and how much has been used either through retail outlets, events outlets, or actually patient trays or patient room service. The reduced time of taking the inventory goes from around 4 to 6 hours in a 1,000-bed hospital down to about an hour. This makes it much more usable to the staff to be able to do, because it's not taking them away from their work for too long, but also then ensures that the information we have in the system can correctly calculate what the expected purchase order quantities need to be. And if we can look at the next slide, we then
I think we were, Bernard, you were already on it. Yep.
Oh, I'm sorry. Thank you.
That's okay.
Excuse me. What we have then is a list of all of the ingredients that we need in our purchase order to be able to serve the forecasted amount that we have placed in the system. This also looks at your current stock on hand and the expected deliveries that are expected to come in between now and the next delivery date. This again takes the guesswork away and that just-in-time essence, so that you have stock to assist in case some stock doesn't come in, or if there's a delay with adverse weather, you would still have the stock to get by until the goods can come in. On the next slide, we then have the ability within a menu management system to create production lists and also scaled recipes based on the forecast that we're doing. So on the day of production, you would create production lists based on the forecast that we've put into the system. And then based on the forecast, the recipes will automatically scale to the forecasted amount that you need to make, not what you've included when you created the recipes as what their portion yield can be. So the system automatically does this. We can also then have the ability to have picking lists and mise en place lists, so that the ingredients that are needed to make all of the recipes for the patient line, for retail and for events is picked on a tray or a trolley and taken to the kitchen, so that chefs aren't constantly going in and out of fridges and picking what they need or what they think they need to make the recipe. This ensures that the chefs or the cooks at site are following the recipes that dietitians have coded and have stated are good for their patient census. So, for example, if you have coded a recipe that is fine for a renal patient because the sodium value is low enough, however, if a chef can just go into the dry store and pick some more salt and add some more salt, no one would be aware of that, and therefore the recipe is now not appropriate for that renal patient, but they potentially could get that. So it enables us to be much more controlling around patient safety, as well as reducing costs, because of a more yield is put in there. So something like a beef casserole, if you put in twice as much beef as it calls for in the recipe, because that's what you think you need, your costs are all totally out, as is your inventory. If we can move to the next slide, the next key point of being able to save and forecast correctly within a facility is to have a point of sale solution in the retail areas of the facility. There's huge amounts of point of sale retailers out in the country, and software, menu management software is able to integrate with most of these, if not all of them. What this allows us to do is that as your retail area is serving the day and creating all of the sales and taking all the payments, at the end of the day, we can get a feed from the point of sale system that says how much sales has been done throughout the day. This will then deplete the stock from the retail outlet so that at the end of the week or the month or the period, an inventory can be, or a stock take can be completed. And you can see if there's any wastage. That could be through pilfering or someone not putting through sales correctly, but it can be monitored and gives you the opportunity to really see what's going on in your retail outlet. Without these systems in place, it's very easy to not know how much inventory is coming in and how much inventory is going out, and therefore what should be left. If you don't know how much stock you use to fill the fridges, there's no way to know how much you've sold. So it's a really big advantage and pretty inexpensive in the bigger picture. Some systems are less than sort of $1,000 to put in place and give you that functionality that we've just spoken about. Moving back to the patient area, another area that I found quite amazing when moving into the healthcare was the pantries within the organizations. There was no control in most of the sites that I have been to through my 6 years being in the healthcare area of Delegate. And most facilities allow people just to go into the dry stores and storage locations to take out what they need without even indicating that they've taken it, so it just sort of disappears. With the floor stock module within the menu management software, you're able to give control of what's being ordered to the service unit itself. So someone from the service unit, either the nurse unit manager or the service unit assistant, would log into the system and place an order, as you can see on the left-hand side of the screen. It's a configured list of items that are available, the price of the item, and then how much they need with a delivery date. This then makes the unit aware of how much they are ordering and how much they're really spending on a delivery, instead of just the food service bearers coming and filling up the pantry based on par levels, and no one really knowing where that stock's going. And at the end of the month, you then have to try and collate how much is up there and how much the value is. And then you also get into a discussion about, did we really use all of that and where is that now? Once the ordering has been completed on day of delivery, on the right-hand side of the screen there, you see the delivery note, which states everything that is going to be delivered, the quantity and the name. This would then be signed in duplicate and one taken back to the kitchen and then one given with the service unit. At the end of the period, you then just run a report out of the system which tells you how much each service unit has spent over that period. There's no manual calculations, and the finance don't have to work out all the GL codes. It's all in the system. They just have to translate that into your P&L and cross-charge across from departments. Moving more in detail of the additional savings, and this is very rare that sites do this, certainly in America. Before moving to America, I was 6 years in Australia running the Australian office, and they started to adopt what we call back office interfaces. The back office interface is an interface between the menu management software and the third-party accounting system like SAP, Navision, Oracle. And what happens is, currently, if you're not having a back office interface, a delivery will be received to the kitchen, and then someone signs off to say that it was delivered, and the invoice goes to the food service manager. They will then have a stamp that's got the grid of boxes, and you put the GL codes and you split down how much is in each GL code. And then that paper invoice goes to the finance department, and the finance department then manually key that in for it to be paid to the vendor. With a back office interface, you skip the whole manual coding and the whole duplication. What happens is the chart of accounts or GL codes are entered into mapped into the food service management software. And then on creating the invoice and the invoice being authorized for payment, a file is created and sent to the third-party accounting system, which then allows the payment on. No one's had to rekey anything. The chance of something going incorrect because someone doesn't put the information in correctly is gone. We had an organization in Australia do this across their whole organization, across the whole of Australia and New Zealand. And what they were able to do is they were able to relocate staff from their finance team into other areas where it was needed. By around 60%, they reduced their accounting department because there was no duplication of work across the board. The system managed everything, which then means that you get more savings because the system is taking away the need for people to manually code, which is, we never want to see people out of work, but we need to make sure that we're being smart, especially in the economic climate that we're in right now. The next two slides are a KPI benefits realization from a site that went live in 2012. It was a public hospital in Canberra, the capital of Australia. And post 2012, they were completely manual paper, and that was about it. They did, I'm not going to go through the two screens in total. You can look through those when you get the information, and then if you have questions about it, obviously you can bring those through to us. But in all 10 areas of the KPIs, they looked pre and post. They were able to see an improvement and achieve their targets. One of the big things that they had was a reduction in wasted meal trays and also in callbacks. So they would have, pre my meal, they would probably have 60 to 80 callbacks a meal, and that dropped to around 20 to 25. So that's a huge saving on people's time. And when we say savings, we're not necessarily just looking at a figure, but we're also looking at how smart are we working. And it really assists in doing that. And one of the big things with a menu management software that you can do bedside ordering or room service is that your patients are ordering as close to the meal time as possible. This takes away confusion. If I'm placing orders today for tomorrow, and I've gone up at breakfast today to get my orders for tomorrow, some patients get confused and think what they're getting for lunch today is what they've just ordered, and then there's confusion there. But also today I could be feeling really well and order a full tray that's going to cost $20 to produce. But on the day of food service, I may feel really ill and only want a soup. So the food comes up, I'm not hungry for it, and I get then a duplicate tray, and therefore we have waste. Also with the menu management system, we're only sending food to those patients that are still in-house, and we're also sending them to the right location. What can sometimes happen without a menu management system is that your nurses are the ones eating the meal because you're sending trays to service units where the patients no longer are. So it's a big saving on that alone. And also, therefore, your patient satisfaction goes up because what I'm getting is what I'm wanting. So the right meal at the right time to the right place. Della, back to you.
Okay. So in food and nutrition services, we deal with a lot of regulatory requirements. A couple of main ones is we're required to show the nutrient analysis of our menus, and then there's also some new food labeling laws. With the system, and on the next slide you can see a sample report, we're able to get nutritional analysis out of our menu. In a system, your food items are coded to the USDA nutrient database or manufacturer information, and we can with one click create a report that gives us the nutritional analysis of our, say, regular, this is an example of a regular menu at a facility. The nutrients that we see is very customizable, and we compare this menu against a goal. So if you want your daily requirements to be the goal that are from the USDA, you could put that in as the goal, and then the report will show you if you're meeting that or not. On the next slide is a picture of a nutrition facts label that's available from a menu management system. There were some new labeling requirements that were set to go into effect this year. I think they've been postponed again, or there's a limited implementation at this point. So you have to have 20 units or more in order to be required to label your information. So it's not to everybody at this point, or the smaller facilities, but by there being some mandate around food labeling, our customers are used to seeing this information and they're asking us for it. And without a menu management system, it's very difficult to provide this information around calories, fat, carbohydrates, as well as maybe any potential allergens that are in the products that you're serving. And with a system, you can create a label based on your actual recipe. The next piece of a menu management system is it helps us manage our patient information. We get our admits, discharge, and transfer information. We know what food allergies are. We know what the diet the patient has, as well as we know the patient's like and dislike. And we have this information in real time. Items on a patient menu that we're offering will reflect their allergies and diet. Only what compliant is allowed. If a patient's unable to select their meals, the non-select meal can be modified by likes and dislikes. Our patient safety is improved because we know about our patient and will not send a food that a patient may be allergic to, or a food that is not compliant to their diet. And based on, we're relying on staff currently knowing appropriate textures, and it's really difficult if you get an allergy you're not used to, like a corn allergy. Is somebody going and reading all your labels to make sure corn syrup is not in the tomato sauce? Another piece that a system helps with is the patient experience. We're able to take our orders closer to mealtime, and Adam discussed this briefly. We can take orders either with a call center at the bedside, or with the patient could use their own device. And while we're taking an order, we're actually able to monitor the nutrients. When a patient orders what they want, there's less waste. They are more likely to consume what they have ordered, which improves their nutritional status. When you have true on-demand room service, we see a greater improvement in patient satisfaction. In the Journal of Academy of Nutrition and Dietetics, February 2018 edition, there's an article, Room Service Improves Nutritional Intake and Increases Patient Satisfaction while Decreasing Food Waste and Cost. And this research was done by Sally McRae and her team at the Mater Health in Brisbane, Australia. And there's great data there supporting how they were able to improve satisfaction, improve patient nutrition status, at the same time decreasing their costs. And at a recent Go Live I did at a VA facility, we were able to actually see some of these results also. And due to construction, we weren't able to have a full room service kitchen, but the Nutrition and food service management wanted to get off of their non-select menu, so we helped them go live with a modified type of room service. We used their tray line, so we had steam tables. The grill was too far away to make a lot of to-order grill items. But the change that we made was the patients were now able to choose what they wanted to eat as well as when they wanted to eat. And patients, when we were looking in the dish room, very little was going in the trash can. And we also had a nurse tell us that a patient on the spinal cord injury unit had not been eating at all and was now eating everything because he was getting what he liked and when he wanted to eat. So this really drove home to me how important it is to our patients to select what they want, and it will help improve their nutrition status. On the next slide, we see what an ordering screen may look like, and we can see that as we're talking to our patient, taking their order, we see the system's calculating the amount of fat, carbohydrate, sodium, and we get warnings. This helps us talk to our patient about making better choices and teaches them about their diet, which when they go home, they're going to be more likely to follow because they know what they can have in combination. I may want a hamburger because that's a comfort food, but I learned that I can't probably order French fries with that if I'm on a cardiac diet, but I could have salad or fruit or a vegetable with it instead. Adam's going to talk about ordering on your own device.
Thank you. So, as we spoke about earlier, organizations are now allowing their employees to work on their own devices, bring their own devices in. So if we're allowing our staff to do this, why can't we allow our patients to do this? We have been working diligently on this topic and have released a mobile meal ordering option that can work on any device that patients may have, so tablets, iPads, iPhones, Android, Windows tablets. If we look at the next screen, we have a sample of what a screen would look like. So on the far left, you will get to a login page where the patient will put their MRN and a PIN number for the visit that they're in. And then what they see on the option is each of the meal times that they can order for. These can be controlled and configured. So if you don't want a patient ordering so far ahead, you can cut that down to just 2 meals in advance, or you can have it as many meals in advance as you wish. Once they pick their meal time, they're shown a screen with all of their options. And again, like Della just pointed out, everything that is visible to the patient is based on their diet and their allergies. So nothing is able to be ordered that's not compliant. We are working on advancements so that we can have nutritional rules and alerts on here as well as pictures in the short term to enhance this. The reason that we also thought this was good for the patients, not only because that's where we're moving to technologically in the world, everyone has their phones strapped to them, sometimes dangerously walking across the road reading their phone instead of looking where they're going, but it's the way of life now. So why not in a hospital have that ability? And also, if you're a patient that's not getting many visitors, you then have this to look forward to. And sometimes I find myself saying this and thinking, well, that sounds a bit stupid, but in a hospital, you don't want to be there. And the only thing that you can control while in hospital is what foods you have to eat. So why not allow them to do this? And then they've got something that they can do, something that they're feeling they're accomplishing, and also getting the food that they want. Della, over to you.
So when we were at HIMSS, there's, of course, a lot of focus on technology, but another point that was brought out was technology can help us with our customer experience, but technology can't fix a broken customer experience culture. So if we're just thinking we're going to bring in technology and, wow, everything's going to be great, we have to have a healthy customer experience culture, be very customer-centered. And then technology can help us do our jobs. It can make us more efficient, which then will allow us to have more face time with our patients. Next, we're going to talk about why facilities maybe don't have software. And in the poll, it looked like it was pretty even as far as people on this webinar with software in their department versus those without. For those of you that don't have software, oftentimes it's the cost of the initial investment and a lack of resources to build and maintain a database. And depending on the size of your facility, the resource to maintain a system can be anywhere from a quarter to a full FTE. And it can typically take 9 to 12 months or even longer to build a database. And in that 9 to 12 month range, you're typically spending 30 hours a week focused on that. And we find a lot of times it's the clinical manager that has responsibility for a system in addition to all her daily tasks. So being able to allocate 30 hours is very difficult. Software and hardware can cost anywhere from $50,000 to $100,000 or more to implement a system, and a lot of facilities don't have that money within their department. We're going to Stella, which is a software menu management system that DM&A manages, is fully cloud hosted, and we're doing that work for you. So you don't have the hardware costs that you would have with the traditional system, or the need for resources to be able to take advantage of the benefits of a system. So Adam's going to talk about the fully integrated system and the benefits.
Thanks. So as Della pointed out, the Della menu management system that DM&A hosts and manage works on the Delegate group platform. So that is made up of a central database, as Della says, that sits in the cloud. And then from the local facilities, you just need a browser-based laptop, PC, mobile device to be able to connect over the web browser. And from that point, you can do all of the things that are being shown here. So we can do our patient meal orders, we can do our room service, we can do our kitchen logistics, which would be your tray tracking. We can then do our purchasing, our receiving, our interfaces to the back office accounting POS system, and interfaces to the EMRs. And we also have the ability with purchasing and inventory management to go and do B2B or EDI ordering. So this allows the system to communicate directly with the vendors, and vendors within the US that we already have B2B interfaces set up are Cisco, GFS, US Food, Benny Keith in Texas. And this allows, again, less work for the users to do. They create an order in the Stella application, and on booking the order, it automatically goes straight through to the vendor, and the vendor pick and then deliver it. You also, if you use B2B EDI, tend to get a cheaper price on your case rates, but that depends on the customer and the vendor to go through that. So on a fully integrated menu management system like Stella, you can do all of these things from a single database, and you don't have to go to any certain PCs. You can walk around the facility doing everything you need to do without having to be at your desk, so you're not tied down to the chair and the desk like you would be in some other menu management systems. Della.
So how do we get to that point? It was obvious when we were at HIMSS that food nutrition services is underrepresented at the technology table, and that there are technology dollars within your organization. You wouldn't dream of today not having electronic medical record or pharmacy not having a system so that they can check a patient allergy against the medication order. We in food nutrition services need to educate our CIOs and our CEOs, CFOs on the importance of having technology within our departments. Food cannot be served to a patient without a diet order. That's mandated by CMS, but we're unable to track a patient's allergies with that diet order. Less than 50% of food nutrition departments have software, while 100% of pharmacies have software. How many near misses are there that we're not aware of? One incident of serving the wrong food to a patient, either due to an allergy or they're on a dysphagia diet and gets the wrong texture, can be costly to the organization. Food is medicine, and we need to be able to provide it safely to our patients. So Della helps us with that. And on the next slide, we have some points as to why Della is a way that maybe we can get to the technology table. There's a lower initial investment. Facility needs less hardware. There's only one server needed in the facility, and sometimes it can actually be a shared server, so there may not be hardware investment. We're licensing by your patient day, not by your licensed beds. And you don't need a resource in your department to maintain the database. DM&A does that work for you. So with that, you can have all the benefits to maintain the system, of a system without the expense of some of the other systems. Are there any questions?
Thank you so much, Della and Adam. Yes, folks, at this time, we will do a short Q&A session until the top of the hour. So if you have a question for Adam or Della, please type it in the questions box in your GoToWebinar control panel at this time. And we do have a couple of questions that came in thus far, and I'm sure a few more will come in. And I'll read the first one. How do you manage a patient ordering system or menu management system when there's a power outage or system glitch? How do you get current patient diet orders, print out either a patient menu tray slip for production service, get correct production needs per patient, diet, recipes, and service needs, for example, hurricane, etc.?
So just like for even a non-technology scenario, you have your disaster plans and your backup plans. So you would definitely still need to have those in place. Those look a little bit differently when there's technology, but you may, if power is totally knocked out, you may need to be in a manual environment. And when the system's implemented, we look at all of those different scenarios. The nice thing about being cloud hosted is that if your local hospital network is down, you still have access to the food nutrition system if you have power, because we're not tied to your network. You may have to manually update your diets because the interface is down, because the local medical record is down. Oftentimes, IT systems, electronic medical record interfaces are on the backup generator. So again, if you have a computer that's plugged into the backup power within your facility, where your database is in the cloud, so then you would still be able to function.
Thanks, Della. Next question. We don't have room service. Can software still provide benefits?
So yes, so I think all of the back of the house, managing your inventory, your menu, your production, you can realize those costs whether you're in a tray line environment or a room service environment. And even in a standard tray line, if you're getting selections from your patients and with a system, you can get those selections much closer to when the food's being served. You can still get some of the benefits of reduced waste on your tray line, sending trays with the wrong diet order.
We do not have Wi-Fi in the patient areas. Is it still possible to take meal orders?
Yes, within the Stellar application, and I can only talk to the Stellar application from a menu management side, we have an offline capability so that even if the Wi-Fi was down or not available, you would still be able to take patient orders. And when you get back into an area of Wi-Fi or connectivity, the system synchronizes and uploads all of the meal orders and all the changes that were made.
Thanks, Adam.
No problem.
Does this system interface with hospital IT systems such as Cerner, Meditech, Paragon, Epic?
Yes is the question. We utilize a middleware interface engine called Rhapsody from Orion Healthcare, and as long as the sending system has capability of HL7, we're able to interface seamlessly. With some systems such as Paragon, they don't always send out information in true HL7, but the beauty of the Rhapsody interface is that we can translate the message being sent out of those non-compliant HL7 systems into a compliant HL7 message so that it's still in use and can be used.
What is the F tag that says we need to have a nutrient analysis of our menus?
I'm not sure what the tag number is. I do know that in California, Title 22 is very specific. So I think some of that comes down to your state and your state regulations versus the CMS national regs.
Okay, we have time for one more. How does this impact the shrinking dollars in so many small nonprofit nursing homes?
So I think as dollars shrink, the better able you are to manage your food service budget and your food dollars, and having a system helps you do that. Prior to joining DM&A, worked for a hospital that was losing money. So over a 3-year period, our budget did not change. And because we had a fully integrated menu management system, I was able to manage my menu cost and stay within my food budget year after year, because we knew exactly what our recipes were costing us. We knew what a recipe cost us and what we were charging for it. In our retail area, we knew what our patient tray was costing us, and we were able to manage to that so that we were able to stay within our budget. Adam, I don't know if you want to add anything to that or not.
No, it's pretty much being able to track what your recipes are, and also the good thing about a menu electronic system like this is that if your food suppliers increase their costs, so an example that comes to mind is in Australia a few years ago when I lived over there, we had a issue where a flood typhoon came through Queensland. And bananas were the rarest of rare. So one week you could get a pound of bananas for 20 cents, and then the next week it went to a pound of bananas for $20. So this, if you continue to buy bananas and put it on the menu, is going to impact your cost, your patient cost and food budget hugely. So having the system show you those costs, you can then remove everything that is contains bananas in one click and replace it with something that's less expensive. So that would take quite a lot of work if you didn't have an electronic system.
Let's squeeze in one more question. I think this is with regard to Stella, who actually inputs the patient menu and nutrient information, and who continues to update this information as menu changes.
So that's the beauty of Stella. It's the DM&A team. So we have a team of people who do that work. So when a client initially signs on, we do the initial menu build. We gain access to their vendor information on the products that we're buying to ensure that the nutrient links are all correct. And then after the initial implementation, if you have a menu change, you need a new recipe, you send that into the DM&A office, and then we enter that and update the menus.
Thank you so much, Della and Adam. Folks, if we didn't get to your question, we will answer each and every single one, and we will get back to you via email with some of the questions that have just been coming in right now. Friends, for those of you that aren't familiar with DM&A, we are a healthcare food service consulting company that specializes in helping our clients in many areas, such as software optimization. If you do have an existing system and you want to make sure that it's running more efficiently and running smoothly, you don't know what you don't know. So we also help with operational assessments to take a deeper dive into your department and efficiencies there. We help with all types of meal delivery systems, such as room service and enhanced dining. If you have a shortage of management staff, we do provide interim staffing, in particular for directors of EVS and food and nutrition services, clinical nutrition managers, executive chefs, and other management level positions. We help with CTSO. We also have a partnership with Happy Chef Uniforms, where we can help your department staff look their very best. And to learn more about all the services that we do offer, please visit our website at destination10.com. Also, friends, tomorrow, or by tomorrow, I will be sending out a post-webinar email, which will include a PDF of this presentation. It will also have your CEU for 1 hour for RDs and CDMs. It'll have a link to a YouTube webinar recording so that you can share with your colleagues, or if you want to review some of the material. And also, as a special for those of you that are attending this webinar, we will be offering a special offer for 50% off the database fee for Stella. So if you're interested in taking a look at that, you do have some savings with this special offer. And in addition, there will be a link on this email if you want to request a Stella demo. I'll also have Adam and Della's contact information if you want to reach out with more questions or need more information. So folks, if you have any immediate needs or require any support whatsoever, please do not hesitate to contact us for a free consultation with Della or one of our amazing success coaches. There is no obligation to have a conversation. We are here to serve you and to help you be successful. Once again, thank you to our presenters, Adam and Della, for sharing your expertise and your knowledge and educating us about the benefits of a menu management system. You both did an amazing job. So on behalf of Della, Adam, and myself, thank you so very much for attending our webinar. Have a great rest of the day. Goodbye, everyone.